If you are currently not active, meaning you are not active at least 3 days per week for a minimum of 30 minutes for at least 3 months, and you are asymptomatic, meaning you have no symptoms and have no history of cardiovascular and metabolic disease, it's recommended to begin with a light to moderate intensity activity, and you do not need clearance. If you are asymptomatic but you have had a history of cardiovascular or metabolic disease, you need to have been cleared within the last 12 months to begin the exercise. If you have symptoms, it's recommended before you do any type of physical activity at any intensity to get medical clearance. For the ones who are active, again meaning you are physically active for at least 3 days a week for a minimum of 30 minutes for at least 3 months, and you have no symptoms of cardiovascular or metabolic disease and no prior history, you are encouraged to continue at a moderate to vigorous intensity exercise without clearance. If you have no symptoms but have had a positive history of either disease, you are encouraged to continue with a light to moderate intensity exercise without clearance, but you should seek medical clearance before progressing to a vigorous intensity. And lastly, if you have symptoms regarding your history, it is recommended you seek medical clearance before continuing any exercise intensity. Cardiovascular and metabolic disease signs and symptoms include angina, shortness of breath at rest, mild exertion, or laying down, dizziness, ankle edema, tachycardia, and heart murmurs. Light intensity consists of 57 to 63% of your heart rate max. Moderate intensity is 64 to 76% of your heart rate max, and vigorous intensity is 77 to 95% of your heart rate max.